Newtown Congregational Church friends and neighbors. This is Reverend Matt with my first Rev Report in this new era of finding our way in the midst of this coronavirus pandemic. As many of you know by now, Newtown Congregational Church has closed off all of our person-to-person contact through meetings and worship. We are going to try and do any number of online connections, and this is my first attempt at this one. So a lot of you are wondering, why has Newtown Congregational Church decided to do this? Well, I think the best thing that I can do is show you this little flattening the curve graph and hopefully help you to understand a little bit. I know sometimes it feels a little strange. Why are we doing this now? There's not that many people that have been sick or diagnosed right now. But from what we know, probably there are more people out there who are carrying this virus who haven't been tested and who aren't even aware of it. And there's a line here. I hope you can see it. This line represents the healthcare system capacity. That's what our healthcare system can handle in terms of the number of people who need critical medical attention and care. And that line is there. And in the midst of a pandemic like we're experiencing, where a lot of people could potentially get sick, you see this big pinkish curve that's up here that's much higher than what our capacity is. And if we didn't do anything as a nation or as a community, more than likely both our regional and even national healthcare systems would just be so flooded with people who are ill, and then especially people who are critically ill that need a lot of care, that it would just overwhelm our system and people wouldn't be able to respond. Now, if we can do things like this social distancing that we're doing, by not getting together, by not passing it, then what we do is we can flatten out the curve, they call it. And that means a number of people are still going to get sick, and most of us, it's not going to be too bad for us, hopefully. It won't be fun, but hopefully we'll get through it and we'll be okay. But if we're able to flatten that out so that not so many people get ill right at once, then what we can do is make sure that that line, that critical line of providing care for people, is taken care of. And that's why we're doing this, because person-to-person contact in groups, but also in small, just one-to-one, where people are getting close to each other and not keeping distance, and passing the virus by touching things that then other people touch. That's what is one of the key things that we can do. So that's why we're not meeting. And we really encourage you to take this opportunity in your homes to be with your family. This really isn't a time for play dates. If you have younger children, for neighborhood kids all getting together and doing stuff, even though everybody seems like they're healthy. Unfortunately, that's just a way that we're going to pass this along. And while most of our young people and even most of us might not get too sick, what can happen is we end up passing that along in unintended ways that then cause this crash that just really puts a stretch on everybody and makes things just unsafe for people. So that's why we're not having in-person worship. But the good news is we are having online worship. We're going to have a live stream of a worship service tomorrow. Reverend Kristen and I and a couple of other folks, we're going to be keeping our distance, but we're going to be filming in a way that hopefully helps you feel included and a part of our worship time. And you can find that tomorrow live streamed on YouTube. So if you have it, YouTube on your app, on your phone, or on your your iPad, or on some other device, just go to your YouTube app and in your search bar, put in NCC, all in caps, -CT, and that'll take you, you'll be able to locate our site and look for that site for the live stream. And if not, know that we're going to be emailing out the worship service a little bit later in the day so that everybody else can just click on the link and hopefully also be able to see it. That's going to be it for now. That's more than enough info. Certainly we are all praying for everybody in our community, especially for all those folks who are working hard to try and promote well-being, whether they be our political leaders as well as folks, doctors, nurses, and healthcare providers, and everybody else who's doing above and beyond and maybe facing some real challenges in the coming days. Hopefully everything's all right with you, and look for some more Rev Reports coming soon.